For me, those who are doing good UX design are those who are continuing to ask questions, and questions that are going to reveal more and more about the design.
Welcome to another episode of HFIG Talks, a podcast produced by the University of Toronto's Human Factors Interest Group. This episode is the second in our series on early career experiences in UX. In this episode, we are joined by Dr. Anthony Soung Yee from the Healthcare Insurance Reciprocal of Canada. And we also have a guest host for this week's interview, Professor Deborah Tihanyi from the University of Toronto's Engineering Communication Program.
So welcome to our conversation with Anthony Soung Yee. And I'm Deborah Tihanyi. I'm an associate professor in the teaching stream with the Engineering Communication Program and iSTEP. And Anthony, maybe we'll start by having you tell us a little bit about yourself and your academic background and what interested you about human factors in UX.
Absolutely, and thank you for having me. As Deborah mentioned, my name is Anthony Soung Yee, and I'm currently a Senior Healthcare Risk Management Specialist at HIROC, which stands for the Healthcare Insurance Reciprocal of Canada. In terms of academic background, I did my undergrad in electrical engineering at University of Ottawa, and I had the wonderful opportunity to explore a number of career options through the co-op program there. And one very meaningful and poignant co-op position that I held was at the Communications Research Canada, and I got to work with a perceptual psychologist in investigating algorithms for converting 2D television signals to 3D television signals. In other words, kind of the early pioneering work in stereoscopic 3D television signals. So as I mentioned, working with perceptual psychologists was actually really eye-opening, because my experience up until that point in engineering was very technical and a little bit dry from my perspective, in my opinion. But he really kind of opened up a whole new world for me in terms of understanding the interaction between technology and the way that humans process information. So I learned a lot from that co-op program and that co-op placement. And when it came to thinking about grad school and furthering my education, I can honestly say that I kind of Googled a little bit more about that, understanding about human perception and engineering. And the term human factors came out of the Google search. It was actually one of the first things that came up. And I learned that University of Toronto was, of course, one of the pioneering academic institutions in human factors. And that just piqued my interest. And I went on to complete my master's and PhD with Professor Paul Mugram and at University of Toronto.
So can you tell us a little bit about your professional journey and what you've been working on since you graduated from U of T?
Absolutely. Since graduating from U of T, I have worked in a number of industries doing human factors related work. Some of those industries include industrial applications of augmented reality and mixed reality, consulting in the aerospace industry with clients such as MDA Robotics. And I've also worked in the healthcare industry in a number of capacities. Overall, I've worked mainly as a consultant in these industries. For example, in healthcare, working closely with device manufacturers to build safer products that are more efficient, that better represent the tasks that need to be completed using those devices. Working with frontline staff and unit managers in hospitals and other healthcare institutions to ensure that their processes and procedures are safe and effective for both the patients and the workers who are completing those tasks. And at HIROC, we have a mandate to partner with organizations, what we call subscribers, to help create the safest healthcare system. And that involves, again, a number of patient safety initiatives and projects aimed at turning the corner on patient safety.
This is all really interesting, and I'm thinking about what you're talking about with patient safety. And you mentioned products, but you also mentioned processes.
Mm-hmm.
And so I'm wondering how that relates to user experience design.
Yeah, absolutely. Just like products, we believe that policies and procedures and the interactions between objects, policies, procedures, and technologies are all things that can be designed. So we take a human factors approach to designing all of those facets of the interaction between people and their environments, and as well as considering, and especially in healthcare, the culture that those things exist in, and the different stakeholders that need to be taken into account to design better systems.
So, which part of the UX design process do you personally find most interesting?
I think the thing that I find the most interesting is working with various stakeholders, especially those who are in industries that are different from my own. Perhaps it's just a personality thing, but I've always been interested in kind of being in the world of other people, and experiencing the world through their eyes, and asking questions and probing a little bit into how others kind of understand the world so they can help me understand what their priorities are, what their predilections are, what are their, in some cases, preferences, all in the vein of helping them to translate their requirements and their needs into better products. So I think that happens on the information kind of gathering side of things of the equation when I'm talking with end users, potential end users for the products we're designing or the services we're designing. But something that's come to bear more recently for me is that on the solution designing side, I think there's a lot to be gained from partnering and collaborating with subject matter experts from disciplines outside of your own. So, for example, at HIROC, so my title is, again, is a senior healthcare risk management specialist. So I get to work with risk management specialists, some of which have a lot of expertise on the clinical side. So they may have been healthcare providers of their own. So they could be nurses, they could have worked in public health, for example. I also get to work with patient safety experts who are, part of HIROC or part of the organization we're working with, and hearing their perspectives in gathering their input on potential solutions, seeing things from their perspective who have lived the lived experience, but also can separate themselves from the ground level kind of work. I think it's just really meaningful. The conversations we have about designing recommendations and potential solutions is always fascinating when you've got people who have experience in occupational therapy, who are nurses, and who also happen to be risk management specialists, patient safety experts, and human factors expertise, which we have, of course, at HIROC as well. And those kinds of conversations just help. They can only help but build better solutions, better products. So that's always the part that I've enjoyed the most is the conversations you have with various stakeholders throughout the design process.
And in terms of that process, how can you tell if you or if someone else is doing good UX design?
That's a very interesting question. For me, those who are doing good UX design are those who are continuing to ask questions, and questions that are going to reveal more and more about the design. I think that a sign of good UX design is one that is trying to address specific problems. And there's a recognition, I think, that you can only design as well as to the extent at which you can ask really, really good questions about what you're designing. So I can tell that something is trending in the right direction if people are continuing to ask questions and they realize that the solutions that they're designing have to be taken into context, that they're really designed in the right context. And they recognize that the one solution can't fit all problems. So if you're continuing to ask good questions, if you're continuing to probe further and further into local context, to me that's a sign that someone's on the right track for designing a solution that's going to fit for them.
And I guess that this is sort of a corollary of that, in terms of the end product. How do you think the quality of UX design should be measured?
Oh, I think that's the $1 million question. People are always trying to, validate their design. And I think that that is something that is the product of iterative design. I think that user experience, just by the nature of what you're trying to design is always going to be changing. So local context is always going to be changing. So I think measuring the quality of user experience has to be adaptive to that as well. We have a number of clients whose needs are evolving, right? So I work with healthcare organizations such as hospitals, and it's no surprise that given the circumstances that we find ourselves in, their needs are constantly evolving. So when it comes to measuring the quality of that user experience, there are a number of tools for doing that. But really, for me, I think it's really about understanding how flexible we can be in measuring user experience. It's really the important part of it, and it's got to be adaptive to the needs of the organization. So one can talk about different tools and things that are quantitative or qualitative. I think there's room for all of those things. And I think you're going to get a richness from understanding the purely objective quantitative measures. But there's a lot to be said about, especially in healthcare, about the quality of experience through kind of really deep understanding of affect, of a kind of emotional response to things. I think there's a lot to be gained there, in addition to the kind of hard quantitative data.
Um, can you think of some of the projects that you've worked on that stick in your memory that might be of interest to students in terms of um, the design process, in terms of how you validated your results?
Oh, absolutely. I mean, I think validation is at the heart of any product or service that you're designing. Like I've mentioned before, we've conducted a number of, usability. In my career, I've conducted a number of usability tests to kind of gather data about the experiences that we're providing. And those are typically done again as usability studies, where we're gathering things about satisfaction, but also quantitative things related to results, percentage of completion, and things like that. But to me, the follow up interview once the usability study is completed is really where you can get all the information from. So beyond kind of the formal feedback that's provided in usability testing, I think having that follow-up interview where things can be a little bit informal, things can be a little bit more conversational. I think that's where a lot of additional value can be extracted as well.
How do you prepare yourself for having those conversations? How do you prepare yourself for eliciting the kinds of responses that you need to get from your stakeholders?
Well, I think it comes down to being aware of your own biases, potentially of your own biases. So there's a lot of attention paid to asking questions in a way that won't be misleading or biasing the person you're interviewing. There are, in healthcare and other industries, of course, a lot of sensitivities around, personal health information, discussing details of a case. So you have to be very careful about the things you're asking and how that information is going to be used. In a way that is safe for everyone, really, where privacy is respected, confidentiality is respected. And I think that anyone you interview in healthcare and beyond, they've got their own set of issues to deal with, whether that's personal or professional. And I think try to come in with a lot of respect for them as experts, and I kind of hope that they do the same for me. And I kind of prepare myself for taking a step back if I feel that my questions are too probing too deep into a particularly sensitive subject. I will recall one experience that I had many years ago when I was at a usability test, and I happened to work with someone who was a professional interviewer, and they were more on the marketing side. And they told me that the number one thing for him was the comfort level of the person you're interviewing. So as soon as they lose their comfort, as soon as they lose their confidence in that relationship, that's the moment that you basically can stop the interview because they won't feel open or comfortable in speaking with you. And I've really taken that to heart in all the kind of interviewing that I've done, whether that's patients or frontline staff, really being cognizant of the relationship you're building, even in a very short period of time between an interviewer and interviewee, and really respecting that relationship between the individuals.
To that area too, I'm curious about how you negotiate the languages of the different disciplines that you come from, and whether that's been challenging for you, coming from engineering, for example, and moving into healthcare.
It has been a challenge, certainly, particularly in places where you are speaking with experts who have done their job for sometimes decades. And they're, like I mentioned before, these people are in their own universe of practice, of professional practice. And the kinds of things they might take for granted are things that are completely new to someone like me, who may not be an expert in that field. So I think there's always kind of a nervous energy whenever I go into an interview like that. The way to hedge against that is to be really prepared as much as you can to know, to anticipate the kinds of things that they might be talking about, but also to have a curious mind and ask questions in a way that continue to frame them as being the experts, but that information that I need um, to have in order to make a better solution for them or for their patients, for example. So it's a thin line to tread, but I think that makes it exciting because you've got to really, I think, on your feet and be adaptive to the situation.
And what about the reverse in terms of having them kind of get comfortable with where you're coming from? You talked earlier about biases, but ultimately you're bringing something to the table as well.
Hmm. A great question. That is something that we think about a lot, or me and my team think about a lot. Is that we do come in with our goals and our intentions. I think that there's a lot to be said about being transparent and clear about what you're trying to achieve, and it is incumbent on us to, uh, when there is a sense that we might be asking questions in a way that might be perceived as being accusatory, or that might impart some kind of blame, to be upfront about it and take a step back, and say that this is all really in the vein of us understanding the problem a bit better, and we kind of need their help to better understand where they're coming from, in order to design a better solution. And by and large, that's worked really well. I had recently a situation like that where those involved in the meeting, we had to remind them and ourselves, of course, what we were trying to achieve, and all in the vein of really improving the situation for all. And I think that went over quite well, actually.
In that respect, can you give us any examples of experiences you've had or you've seen where there's had to be a kind of trade-off between user experience and other requirements, including engineering and business requirements and some of these other areas of expertise that you're talking about?
Absolutely. So, as a consultant, engineering and business requirements are always in the mix. So, time and money to complete something are always factors involved in the design of anything. But one of the really interesting trade-offs that I've come across, specifically working as a consultant in human factors in healthcare, is that I've had the privilege of having to work with organizations who may not have any human factors expertise in house. So, and with the circumstances we find ourselves in with COVID-19, our subscribers we work with at HIROC, some of them may not have human factors experience in house. So the consultancy is really that, is you've got to come up with methods, tools and techniques that an organization with no human factors experience or user design experience, they've got to go and take that and run with it themselves. So the balance is really on what can we provide as a tool or an approach so that those who are not experts in human factors or user experience design can go ahead and complete with our guidance at arm's length. So those trade-offs are really interesting because you've got to educate people on the right techniques that is going to extract information, but you can't necessarily be there at the time where they're doing it. So it involves a lot of training, education, but also just thinking back to your early days in human factors training and education. Like, what was the most valuable? What are the tips and tools you're going to provide that are going to help that person accomplish their goals in a resource strapped and time strapped environment?
So that's really interesting. So, in a way, if I'm hearing you correctly, it's not only about in an organization like that that doesn't have human factors in house, it's not only about working with them on a specific project, it's about giving them the tools that they're going to need to do this on their own, and doing that kind of education in the broader field.
Absolutely, yeah. It's the analogy of providing someone a fish versus teaching them. There are a number of reasons why we take this approach of building capacity. And that happens not just in human factors, but in patient safety and risk management as well. And one of the reasons we do that is because it scales better if you can do it properly, right? So if you can teach organizations on how to approach problems from the perspective of patient safety, human factors, and risk management, they are going to be able to take those learnings and build their own program again with local context in mind. So they are the ones, the individual organizations are the ones who are best able to understand their culture and fit the needs, their own individual needs, to to take our resources and recommendations and mold them to fit the culture in their current organization. And the way we do that, sort of strategically, is to align ourselves with initiatives that they may be working on, and infusing the perspective of human factors and patient safety into initiatives that they might be working on, in terms of QI, quality improvement, for example, patient safety, risk. So kind of embedding ourselves that way has been fruitful for us.
That's great, Anthony. I've got one last question, and you've already started to touch on it a little bit, is where you see the field of UX growing and changing in the future.
Happy to speak more about that. Yeah, I think that throughout my own career, I've had personal questions about the role of human factors, the skills that are required, and how that could be applied in industry. And perhaps when I was earlier in my career, I kind of convinced myself that, given my human factors training and experience, that was the thing that I had to carry on with, that I had to be a human factors person, or I had to be a UX specialist or a human factors specialist. I think my tune has changed a little bit. I think that there are skills that a human factors professional acquires that can be beneficial to a number of industries. And I'm less concerned now with hanging my hat on being a human factors specialist in title. And that's partly because I get to work with such smart and knowledgeable people in other industries that benefit from human factors experience. So again, the patient safety, risk management kind of fields, I think are highly complementary to human factors. I think they can learn a lot from human factor specialists and vice versa. And all in the vein of creating better products, I really see that collaboration being key to moving the needle in terms of patient safety and user experience. Um, the final thing I'll say is that I think there is going to be, and there, we are seeing a huge push when it comes to big data analysis, in the sense that collecting data on user experience and user input in the healthcare system, that is very much the case when it comes to things like diagnosis, medical examinations, EMR records. I'm speaking in generalities here, but there is a huge amount of data to be mined when it comes to understanding trends in patient experience, medical diagnosis. And I think that's really an untapped field where data science and AI is going to be absolutely crucial to furthering experiences in healthcare.
Great. Thanks so much, Anthony, for joining us today.
My pleasure.
Thank you to Dr. Anthony Soung Yee for joining us on the podcast and to Professor Deborah Tihanyi for hosting. We hope you enjoyed this episode and stay tuned for the third and final installment of our series on early career experiences in UX coming soon.